vaccine, there have been many questions that are asked, many questions that are still left hanging, and many persons have concerns. There are some persons who may be anxious in taking the vaccine because they are afraid of side effects or not sure what it really is. And so the purpose of this presentation this afternoon is to bring some amount of enlightenment. We know that, yes, the church is a religious group, but the church cares for the total man. And caring for the total man means that we care for your spiritual needs as well as your physical needs. And this is a part of preparing you to take care of that physical need. And so we want you to ask your questions. Do not be afraid to ask your questions. Listen keenly to the presentation, and then you can write down your questions, and we're going to take the questions after the presentation is finished. So write down your questions. We do not want anyone to leave this forum this afternoon leaving with, yes, we may still have one or two questions still hanging, but I'm sure Dr. Forbes is knowledgeable and she will bring us the information that we all need. We were looking at the fact that Dr. Forbes would have been exposed to COVID-19 in all its realms, in terms of she may have treated persons with the virus, known persons who were infected with the virus, and so she would have had first-hand experience in sharing with us this afternoon. But I'm going to invite Brother Banton to do our formal introduction.
Yes, good afternoon again. Our presenter today, this evening rather, is Dr. Vanselie Forbes. She is a specialist in nephrology and internal medicine. She is employed at the Turks and Caicos Islands Hospital, Intel, Canada, in this capacity as well. She cares for persons with kidney disease, including those on dialysis. She also provides internal medicine services, which includes caring for persons hospitalized with the COVID-19 disease. She's a very caring person, someone who likes to share information. She's cool, calm, and collective. If ever cool and calm and collective was a person, it will definitely be Dr. Vanselie Forbes. So without any further delay, please help me welcome Dr. Vanselie Forbes.
So thank you very much, David, for that kind introduction. Am I allowed to share my screen now? I'll proceed to share my screen.
Go right ahead.
Great. Good. Thank you. So I'm Dr. Vanselie Forbes, as introduced. I'm a nephrologist and internist at Turks and Caicos Islands Hospital, InterHealth Canada, and I will be providing a brief presentation on COVID-19 disease and mRNA vaccines, and this allows ample time for questions. Okay. So SARS-CoV-2, that's the actual name of the virus that causes COVID-19, which we commonly call coronavirus. But it's called SARS-CoV-2 as it is not the first coronavirus. So looking at the images on the left side of the screen, we have an electron microscopy image with color. And so they're spherical, and you might appreciate some spikes arising from the surface of the virus. And that's going to be important for later. And on the right, we have what you've probably seen many times in media. is the CDC illustration of the SARS-CoV-2 virus. So just a bit of background about COVID-19 disease. COVID-19 disease was first reported in Wuhan, China in December of 2019. It was initially called the 2019 novel coronavirus, as it was similar to SARS, another type of coronavirus, which caused SARS in 2003, but not identical. By the 30th of January 2020, WHO declared COVID-19 disease a public health emergency of international concern. Subsequently, after the geneticists and virologists, immunologists got additional information about this virus, it got its formal or its official name of SARS-CoV-2. And on the 11th of March of 2020, the World Health Organization declared COVID-19 disease a global pandemic. So here are some global statistics. In Turks and Caicos, and these are the latest published figures, we have over 1,200 confirmed cases with 7 deaths. In Jamaica, we have over 14,600 confirmed cases and 332 deaths. In the United States, over 24.5 million cases with over 400,000 deaths. Now, and globally, the figures, are quite alarming. They've been alarming already. But we have over 96.6 million confirmed cases with over 2 million deaths. For Turks and Caicos, the numbers appear small. However, for the size of our population, the numbers are quite significant. So how does SARS-CoV-2 that causes COVID-19 disease, how does it manifest itself in terms of illness? Well, the majority of persons infected by this virus have mild disease, up to 80% or so. And we know now that some persons are asymptomatic. And we also know that some asymptomatic persons can spread disease. However, a significant proportion of persons, around 20%, do have severe disease or moderate to severe disease. So whilst the majority have mild disease, there are some members of our population who are more at risk for severe disease. These include our elderly, particularly persons over the age of 65 years, persons with a variety of underlying conditions, including diabetes, hypertension, obesity, heart diseases, kidney diseases, lung diseases, and so forth. There are persons who are immunocompromised, either due to an underlying condition such as HIV/AIDS, or drugs such as chemotherapy for cancer, or certain immunosuppressant drugs for rheumatological conditions, for example, lupus. And then persons who have a history of smoking also have an increased risk of severe lung disease from COVID-19. At least an increased risk of severe COVID-19 disease. So what are some of the symptoms? The column on the left lists the most common symptoms, and these are very similar to the flu. So cough, fever, shortness of breath, fatigue, headache, sore throat. So, it's very difficult to distinguish from the flu or even a common cold, barring the shortness of breath. And then on the right side, we also have symptoms that do occur with less frequency, but are well known. These include vomiting, diarrhea, loss of smell, loss of taste, brain fog or difficulty concentrating, depression, and hallucinations, and even anxiety. So because the symptoms that we've listed are not very specific at all to COVID-19 disease, they can occur with any respiratory virus or with any flu, then it's really important to confirm the diagnosis. So the diagnosis is confirmed based on a PCR test, and that remains the gold standard. However, since the start of the pandemic, lab testing, or testing in general, has come a long way. So we now have point of care testing and home kits, and you may have heard of lateral flow testing or antigen testing. So these can be done in a private clinic, can be done, outside of or in a person's home. So the home kits can be done at home. And as you may have heard in a recent press conference, the Turks and Caicos Islands government has now authorized point of care testing so that the various clinics in the various islands can perform them on site, and you can get a result within 30 minutes. So that should, really increase accessibility to testing and also reduce the turnaround time when you can get immediate result. And you can also isolate persons very quickly to stem the spread of the disease. So what about antibody tests? So the PCR tests and the lateral flow point of care home kits, those are kind of antigen tests where you actually get the bits of the virus particles. But the antibody tests really are testing for the response of the immune system to the virus. And these do not diagnose COVID-19 disease, but they can tell you that you've had evidence of past infection, but it cannot give you a timeline. Now, those are the PCR test, particularly is a diagnostic test. However, if a person has moderate to severe illness, they usually present to a healthcare center, to the hospital, and they often require further investigations. These include a chest X-ray or a CT scan of their chest to look for evidence of severe pneumonia or other complications, such as thrombosis associated with the coronavirus. And then you may have various blood tests looking for various complications and also help to determine the severity of the disease. So checking the liver function, the kidney function, and so forth. And we also need to do a 12-lead ECG to detect any abnormal heart rhythm disturbances. So how do we treat COVID-19 disease? So the treatment really depends on the severity of the disease. We know by now that the majority of the persons have mild disease and some are asymptomatic. So those persons who have mild disease are really treated symptomatically, meaning if they have muscle aches and pains or if they have fever, they can use Tylenol or Panadol. So, but just treating symptoms as they arise and maintaining hydration and so forth. Persons with moderate disease, they are usually hospitalized now, and they often require oxygen. Now, persons with moderate disease are at risk of deteriorating very quickly and very suddenly. So it is preferable for them to be managed in a center that could respond to their changing condition quickly. And then you have persons with more severe disease who often require intensive care unit level management and are often on a ventilator. And I have here quite a list of complications that we try to prevent and treat. Now, we know that the COVID-19 disease is caused by a virus, right, which we will call coronavirus for the sake of this presentation, but it's SARS-CoV-2. However, on top of the viral infection that already is present, a lot of patients with more severe disease develop bacterial infections on or superimposed on the virus infection. And these persons then require antibiotics. Persons can go into severe respiratory failure and are unable to maintain their oxygen, even with high flow oxygen devices, and therefore they might require intubation and ventilation. We then know that the coronavirus can affect the heart, causing inflammation of the heart muscle called myocarditis. And this can result in rhythm disturbances and sudden cardiac death. And we see this particularly in young persons, including young athletes who are otherwise considered healthy and fit. We then know about thrombosis. So COVID-19 disease is associated with an increased risk of thrombosis, up to about 50% in some case series of persons in intensive care unit. And I would just like to mention about the myocarditis, just going back a little bit. These persons are usually on a cardiac monitor so that we can detect these arrhythmias when they occur and then provide treatments to prevent them from deteriorating to the point where persons suffer demise. When it comes to thrombosis, we do provide blood thinners to try to reduce the risk of developing thrombosis, such as deep vein thrombosis, pulmonary embolisms. So by thrombosis, I mean blood clots. So these include the DVTs, deep vein thrombosis, pulmonary embolisms, even strokes and heart attacks. These occur with increased frequency in COVID-19 disease. And if these conditions should occur, then they require specific treatment. There is also a high percentage of persons with severe disease whose kidneys are impacted, and some develop complete kidney failure requiring dialysis. Some patients develop liver failure requiring supportive care. And in addition to the various organ involvement, many patients do suffer neuropsychiatric symptoms such as hallucinations, depression, anxiety, and memory loss. So, severe COVID is really a very systemic condition and affecting multiple organs and can be quite severe. And about the mortality rate, which we will come to just now. So what are the potential outcomes? Well, most persons recover fully. As we've said, the majority of persons have mild disease or a few are asymptomatic, and these persons normally recover fully. However, the death rate is just over 2%. And 2% might sound like a low number, but in context, it is 20 times higher than the seasonal flu. So the death rate is quite high. And since the start of the pandemic, the death rate has actually gone down as physicians and, other healthcare staff have learned more about the disease and learned how to prevent and treat complications. Now, if a person does survive COVID-19 disease, particularly the severe COVID, then unfortunately, many are grappling with long COVID. So this is a syndrome whereby persons who have recovered from COVID continue to have persistent symptoms greater than 3 months after their diagnosis. This affects about 15% of all COVID-19 disease patients. However, a recent study out of China showed that for persons who had the more severe form of disease, so particularly those who required hospitalization, greater than 75% of those still had at least one symptom at 6 months following the disease. So this is long COVID. So people are still suffering 6 months out. And the most common symptoms include fatigue, shortness of breath, cough, joint pains, chest pains, palpitations, and difficulty concentrating, also called brain fog, anxiety, depression, and so forth. So people are still suffering. So given that COVID-19 disease can be quite severe in a significant proportion of our population, then with most diseases or with any disease, you would prefer to prevent such a disease. So we all know now what the public health protocols are. These include wearing a face covering in public or when you're unable to social distance, social distancing of at least 6 feet, hand hygiene, staying home if unwell, along with other measures. Whilst these, and I would like to say that, they are effective to an extent. However, as you and I have seen, people are getting tired and people just want to go back to life before COVID, and people are gathering again. And they should not be, but they're gathering without face coverings and letting their guards down. So, whilst these protocols do work if people adhere to them, on a population level, we know that they're not working because in our country and in other countries, we're seeing surges upon surges. Despite the lockdowns and the various orders, we're still seeing more and more surges. And lockdowns, they might stem the tide for a brief period of time. However, they also they really shut down the economy as well. But aside from stemming the tide for a brief period of time, it is just not an effective long-term model. And frankly, they have not worked. Some countries are on their third and fourth shutdowns. And this is where we are. So we're, over a year since COVID-19 disease first came on the scene, and this has not shown signs of slowing down. So then, how can we bring this pandemic to an end? Well, the short answer is herd immunity. So, what is herd immunity? Herd immunity is where the whole population is protected, but a majority of the population have immunity. And just to give you an illustration, if there are 10 of you in a church building, for example, and 9 have immunity, for example, through vaccination, and 1 does not. The 9 who have immunity have their own protection. However, the 1 who does not have immunity is also protected because the 9 of the persons who have immunity are protecting the 1 who does not have their own protection from getting the disease. And so, herd immunity is most effective as more and more persons do develop that immunity. So the higher proportion of persons who have immunity, the greater the protection for the whole population. So what are the ways to achieve herd immunity? Well, this can occur naturally, for example, through getting the infection, or it can occur through vaccination. Now, certainly in the setting and where COVID-19 disease is concerned, when we see that the mortality rate is so high, and there are people who do suffer severe illness and continue to suffer, just allowing the disease to spread like wildfire throughout the population so that people can get herd immunity naturally just does not appear to be an acceptable option. The cost is too high in terms of lives lost and in terms of health. So, the better way to achieve herd immunity is through vaccination. Vaccination is not new. Vaccinations have been around for centuries now. And we know what vaccination is. This is a process whereby our immune systems are stimulated to recognize, destroy, and remember a pathogen. And a pathogen is any organism that can cause disease. Example, viruses such as this coronavirus, and bacteria, as well as other diseases. So, we've heard a lot about this mRNA. And before I explain what an mRNA vaccine is, I would like to be able to explain what is mRNA. Then you would have a better understanding of the mRNA vaccine and how that works. So mRNA stands for messenger ribonucleic acid. So here we have in the top left corner a cell, and in the center of the cell, the dark portion is the nucleus. And we just have this cross section here that we've enlarged. So in the nucleus sits your DNA. So I'll just follow this DNA strand along. Now, what you can probably appreciate is the DNA consists of two strands. And here you can see that the strands have opened up so that you can see that there are two, and they're wound around each other in a double helix formation. So that's your DNA. The DNA sits in the nucleus. It does not leave. It sits in the nucleus, but it contains all of your genetic information, your genetic code. And that genetic code is responsible for whatever we see manifested on the outside. So if the DNA sits in the nucleus with all of this information, then how do we get this information to the outside world where it can be manifested? Well, first of all, how is that information then manifested? Well, we have here the ribosome. So this structure here, the ribosome can be described as the protein-making factory of the cell, okay, or of the body, the protein-making factory. And proteins, as you may know, are the building blocks of our tissues, of our organs. They're not only structural, but they're functional. So aside from the structural functions of proteins, the functions include enzymes, for example, that aid in digestion of food. So without proteins, particularly enzymes, you would not be able to digest your food. Without proteins, you would not be able to perform certain kidney functions, brain functions, heart functions. So basically, proteins, they perform integral functions in every organ of our body and perform multiple processes. And so these proteins, so they do the work, okay? So that's the manifestation. Now, how do you then get that? So the proteins are the manifestation, and the DNA, they also code for other manifestations such as our heights, our skin color, our eye color, and so forth. So all of the things that are external, even certain diseases that a person may be susceptible to. Now, what the DNA, you're only seeing a very short fragment or a very short segment of DNA, but the whole DNA is not translated at any given point in time. So let's say you require protein X, okay? If you need protein X, you're going to go to that section of the DNA. It's going to unwind, open up, and you're going to have a message sent from the DNA to the protein making factory saying, make protein X. So it's very specific. So how do we get that message from the DNA to the ribosome? Well, that's where your messenger RNA comes in. It's simply a messenger passing this genetic information. It's, pretty much a mirror image of one of the strands, passing the genetic information from the DNA to the ribosome, telling it which protein to make. So that is what the mRNA does every day, every hour, multiple times. It's a part of our normal biological process, okay? It's just a messenger. And so how then does this messenger function as a vaccine? So let us move from that slide and go back here. So how does this messenger function as a vaccine? Well, the question is, what message is the mRNA telling our cells? The mRNA is telling our cells to make spike protein. Now, you may or may not recall from the early images of the presentation, you saw the spikes on the surface of the cells. These spikes are the spike protein. And so the messenger RNA that is contained in the vaccines literally only tell our ribosomes to make spike protein and nothing else. So it is very specific. Remember, whatever protein you need to make, you go to that section of the DNA, it unwinds, and then you get that very specific message to the ribosome to make a very specific protein. But what the vaccine does is bypasses the DNA, which is in the nucleus, and it goes directly, once here's the mRNA entering the cell, okay, in this capsule made of fat pretty much. The mRNA goes directly to the ribosome, gives it the message to make spike protein. The ribosome pushes out spike protein. The spike protein, the body then recognizes the spike protein, even though it makes it, it recognizes it as a foreign entity. And once the body recognizes spike protein as a foreign entity, it starts to mount an immune response to it. Now, and this immune response includes, your lymphocytes, your T lymphocytes, your B lymphocytes, which then produce antibodies and so forth. And so the immune system now, because of the spike protein that the mRNA tells our body to make, is now primed so that in the future, if our body was to encounter the actual coronavirus, our immune system will recognize the spike protein. It doesn't know the whole virus, but it recognizes the spike protein on the surface and starts to attack it. Now, normally, when so thank you. So once our bodies recognize the spike protein on the surface of the actual virus, it can then attack it and pretty much stem that virus from replicating and causing disease. So that's in a nutshell what is messenger RNA and how it functions in the form of a vaccine. Now, when it comes to the vaccines in general, the benefit of a vaccine as opposed to just having your natural immunity through the disease is that the vaccine gives you the benefit of priming your immune system without going through the whole process of the disease, which we know in the case of COVID-19 can be quite damaging. So I will not end here. The next slide has to do with the Pfizer-BioNTech mRNA vaccine. And whilst there's another mRNA vaccine that's approved, the Moderna vaccine, and there are other mRNA vaccines that are still in trial phase, I'm speaking about the Pfizer-BioNTech mRNA vaccine because that's the one that we have here in Turks and Caicos Islands. So just to give you a little bit of information about the trial data and, some of the real world data. So the clinical trial for the Pfizer-BioNTech mRNA vaccine involved just over 43,000 individuals, all over the age of 16. And what that, persons got, a half got vaccine and a half got placebo. Placebo is pretty much an inert substance, a solution, probably just saline, that's injected so that the participant in the trial does not know whether they received the vaccine or not, so that it does not confound any results. Now, what we know from comparing the vaccine group to the placebo group is that the vaccine is 95% effective in protecting against symptomatic COVID-19 disease. And that's much higher than other vaccines, particularly the flu vaccine, that can have 40 to 60% effectiveness. We also know that it is safe. And I just want to point out that this efficacy in protecting against symptomatic COVID-19 disease is important. It's because the trial investigators did not test the effectiveness of the vaccine in protecting against asymptomatic COVID. So those are persons who do develop COVID-19 disease but have no symptoms. So because this was not tested in the trials, we do not know what level of effectiveness this vaccine has against COVID, asymptomatic COVID-19. But hopefully that data will be available soon. We also know that it is safe. So in this trial of over 43,000 individuals, the common side effects were pain at the injection site, fever, fatigue, joint pain. So typical or just flu-like symptoms. And then these symptoms lasted for no more than 2-3 days the max. So those were fairly common. Now, I would like to mention Bell's palsy because there have been videos circulating on social media about a person with Bell's palsy, which appeared quite alarming. And this is pretty much just an inflammatory condition of one of the facial nerves. Now, whilst during the trial, 4 persons in the vaccine group developed Bell's palsy, and there were none in the placebo group. And this particular vaccine trial, the Pfizer-BioNTech vaccine, when they looked at the rates of Bell's palsy in the general population, there was no higher or increased rate of Bell's palsy in the trial group, in the vaccine group, meaning that it was simply mirroring what is expected or what is normally seen in the general population. Hence, the investigators concluded, and the FDA concluded, that there is no evidence that the Bell's palsy was caused by the vaccine. And I would also like to point out from the Moderna trial, which is the other mRNA vaccine that's approved, one of the participants in the placebo group also got Bell's palsy. So we don't think that Bell's palsy is related to the vaccine. Now, during the trial, they didn't actually have any severe allergic reactions, these anaphylaxis reactions that a lot of us are hearing about now. They did not come out, they were not reported until they actually started vaccinating people following the approvals. And so CDC then reported data out of December early in January. And what it showed is that out of 1.89 million persons who received the Pfizer-BioNTech mRNA vaccine, 21 had severe allergic reactions. That's the anaphylaxis. And the majority of these, about 80% or so, had a history of prior allergies. So this is actually very rare. If you consider this, that means for every 1 million person that was vaccinated, from this data set, 11.1 developed an anaphylaxis. And so if you compare this, however, with COVID-19 disease, for every 1 million persons who got COVID-19 disease, there were 20,000 people who died from COVID-19 disease. So if you're going to compare safety, the vaccine, far outweighs COVID-19 disease in terms of being safe. So, at the end of the day, and there have been various reports, and there are a lot of myths concerning the mRNA vaccine. But the hope is that you realize that the mRNA is actually a part of our normal day-to-day biological process. And it's also, it's quite safe. So when you actually look at the actual data, from trials and from official sources, the rates of severe adverse events are actually very low. And so I will end here now state again that the vaccine is safer than COVID-19, and I will invite questions.
Okay, thank you so much, Dr. Forbes. We are going to be taking the questions. So, the first question is, will or can herd immunity really work if those who have been infected with COVID-19 can get it again after recovering?
Okay, so that is a good question, and the short answer is yes, it can. The rate of reinfection of COVID-19 disease is still very low. It's still very low. So if you consider over 90 million people have had COVID-19 disease, the rates of reinfection, they're actually case reports. It's not widespread. So it's still very rare in terms of, people getting reinfected. So yes, herd immunity would still be effective.
Okay, thank you. The next question is that, is there any side effects to someone if someone take the vaccine who may have aspirin allergies?
Okay, so, whilst persons who develop the anaphylaxis, the majority of them had a history of prior allergies, that is still very rare. And at this point in time, persons who do have allergies should speak to their physicians to determine, how severe their reactions were. At the beginning of the rollout of the vaccines in the UK, when 2 nurses developed severe anaphylaxis, the UK authorities suggested for persons who had a history of severe allergies not to get the vaccine. However, since then, and they realized how rare it is as more and more people got vaccinated, they're now recommending that persons who have allergies to any component of the vaccine does not get that vaccine. And if a person develops an allergic reaction to the first dose of the vaccine, they do not get the second dose of the vaccine. So just having a history of allergies by itself is not an absolute contraindication to getting the vaccine. However, that person should speak with their physician.
Okay, thank you. Pastor Lindsay is hand up. We'll take your hand and then we go back to the questions in the group in the chat.
All right, good evening, Doc. I am not anti-vaccine, but I read a lot of news stories, right? So I want to ask a question because normally when I search for a follow-up article, either they don't provide enough information or they don't say anything about the subject anymore. There was this doctor in Florida who got sick 3 days after taking the vaccine, and he eventually died. Is it a case that they found out that he died from the vaccine or some other illness? They said that his platelet count went down and they tried everything and it didn't work.
Right. So at the moment, there's no evidence that that doctor died from the vaccine. It appears that person had a brain hemorrhage, and there's no real mechanism by which that vaccine should cause a brain bleed. Okay. So yes, there was a report of a doctor in Florida who died several days, I think over a week after obtaining the vaccine, but there is no evidence to say that the vaccine was a direct cause of the death.
All right, thank you. So, J. King is asking, so you are saying you trust this vaccine. Also, doesn't it change my DNA? And that is a question that a lot of persons have been asking. Does the vaccine change your DNA?
Okay, so the mRNA vaccine, so here's your DNA in the nucleus. The mRNA vaccine does not enter the nucleus and it does not change your DNA.
Okay. Mr. Sinclair is asking for a little bit more information on natural immunity.
Okay. So when a person, develops if a person is exposed to a virus, let's talk about the COVID virus, the coronavirus, since that's what we're speaking about this evening. The body recognizes it as a foreign entity and starts to mount an immune response to it. The average time or the minimum time it takes for the body to mount an immune response is about 7 days. Okay. And however, with the COVID-19 disease, as we can see, 7 days is a long time for that virus to do a lot of damage to a lot of people. So, yes, the body mounts its immune response, but it takes a minimum of 7 days. Now, once a person gets infected with coronavirus and recovers, that person still has a degree of natural immunity. And what we now know is that that natural immunity lasts for at least 6 months. Now, as time goes by and more data is collected, then we'll have more information to see whether or not it's lasting any longer than that. But so far, the data is showing that the natural immunity lasts at least 6 months. In terms of the reinfections, there have been reports. If you consider how many millions of persons have actually gotten COVID-19 disease, but there have been few reports of reinfections. And in addition, persons generally who got reinfected, they tended to have a milder form of the disease than the first time. So the natural immunity will occur as with most infectious diseases. However, at the end of the day, what we do know is that it does last for at least 6 months. However, to rely on natural immunity for herd immunity, that means a lot of people will have to get sick and a lot of people will have to die in order to achieve herd immunity.
Okay, thank you so much. We'll take one more question and then I take the answer. Um, someone was asking, okay, that question was answered already in terms of if you receive the vaccine, if you can still get COVID-19. A question is asked, does the vaccine have any effect to fertility of a young lady in their future? I think that, yeah.
Okay. In terms of the question about fertility, there is no evidence that this mRNA vaccine causes infertility. A lot of people are concerned because of the advisory about pregnancy and waiting 2 months to get pregnant after receiving the vaccine. The reason for this is that there were no pregnant women included in the trials. And so, because there were no pregnant women included in the trials, we do not know the impact on the pregnant woman. We do not know the impact on the fetus, for example, if there are going to be any fetal abnormalities. And so, as a precaution, since we do not know, as a precaution, persons were advised to delay pregnancy for, at least 2 months after taking the vaccine. But there is no evidence that the vaccine causes infertility.
Okay, thank you so much. I think Suzette Miller had her hand up. You can go ahead and ask your question now.
My question had to do with the whole matter of changing the DNA, which somebody else had asked. But it was more, I was really concerned about the whole matter of the ethical part of it. If it was possible in any way that it could be used potentially in the future to alter DNA sequencing.
Right. So I mean, that's an interesting question. So mRNA is pretty much just a messenger. It just pretty much transcribes or writes down or copies what's on the DNA and passes that message to the ribosome. So it's literally just a messenger. It doesn't alter the DNA. Now, so that's mRNA. Having said that, there are other gene therapies that are on the scene, that are in research phase now, where there is actual, alterations to the DNA, but that does not involve mRNA. So no, mRNA does not alter the DNA, and it's just literally whilst it passes a message from the DNA to the ribosome. If you're giving the person the mRNA, then it just goes directly to the ribosome with the message you want to give that individual, telling the ribosome which protein to make. So you are given the ribosome direct instructions, but you're not impacting the actual DNA. But the whole field of gene editing, it's an area in medicine and research that is growing, and work is being done extensively in that area. And yes, ethical issues are being raised, but that is not the case with the mRNA.
All right, thank you so much. This question was asked, but I think the answer came already. If one cannot have, as it regards to allergy, like if after persons are screened, they are not allowed to take the vaccine, what is the general reason? If one cannot have the flu shot because of allergies, would it be the same with the vaccine? I think you answered that question already in terms of persons with allergies. Speak to your health practitioner first, and also prior to taking the vaccine, you are also being screened by a doctor. A triaging process is done where you fill the form out and you are screened by a doctor before you receive the vaccine. So at that point, you'll be able to express your concerns as it regards to your allergies. That question was answered already. So the next question is, how long does the effect of the vaccine last, and how effective is the first dose alone?
Right. So at this point in time, it is not known exactly how long the effect of the vaccine would last. We anticipate that it would last for at least a year, but at this point we don't know because it has not been that long since the vaccines were produced or approved. So that has yet to be seen, and we don't know whether the immunity will wane over time. In terms of the protection after the first dose, the evidence from the trial shows at least 50% protection, at around 12 days or so after the first dose. So there's some degree of protection for this particular vaccine. It's just about 50% after the first dose. But then it goes up to 95%.
Thank you. Brother Banton, are there any questions? Are there any questions from YouTube before we take the remaining questions on Zoom?
I'm not seeing any. I'm just going back to the YouTube channel now just to find out if just to see if there are any. But at the moment, I'm not seeing any. I did have some issue when using my phone, so I am just tuning in with my computer.
Okay. All right. So the next question is asked. It's a comment and a question. Thank you, Doc. I understand the vaccine that we receive have a shelf date. How long is it? And can you say what is the shelf date for the vaccine that is in TCI?
Right. What was reported by the Minister of Health was that this vaccine shelf date, so to speak, that the batch we have will expire at the end of March. Now, from the time of production to the time of expiry, I don't know what the shelf life of the vaccine is, but what we were told during a press conference, by the government officials was that the batch we have will expire at the end of March.
Okay, thank you so much. The next question is asked, getting the vaccine, do I still wear a mask? And is COVID testing necessary for traveling?
Okay, so the first part of the question is yes, you still wear a mask after receiving the vaccine for a number of reasons. What we know is that this vaccine is, 95% effective. So that's not 100%. It is 95% effective against symptomatic COVID. Now, whilst we anticipate that it will be effective against asymptomatic COVID, we don't know how effective this vaccine is against asymptomatic COVID. That is COVID with no symptoms. But that data should become available shortly. So I'm looking forward, I'm sure a lot of people are looking forward to reviewing that data to see whether or not the vaccine protects us against asymptomatic COVID. Having said that, we also know that persons who have asymptomatic COVID can still spread the disease. So since we don't know the level of protection in that group, and we know that that group can still spread the disease, then there's still a vulnerability in the population. And then there are persons who cannot get the vaccine, whether because of their history of allergies, for example, to the first dose, or they're just very frail, or their physicians, feel that for one reason or the other, or maybe they're pregnant women or their children, they're under the age of 16, they're unable to get the vaccine. And then you generally have the whole public health issue where the protection when it comes to herd immunity really is achieved when a majority of the population is vaccinated. So you're looking at about 80%. So you want about 80% at least vaccinated before we can achieve herd immunity. So until we get to the point where we can say we have herd immunity and there's evidence that the virus is not transmitting at any significant degree throughout the population, then, and we know about the impact on asymptomatic COVID, then we will still need to wear a mask.
Thank you. This question has been a recurring one. Someone just joined and they were asking. So just to reiterate the point, could you just go over what are the main reasons for one to be rejected from not getting the vaccine? So what are the reasons why one would not receive the vaccine after screening?
Okay, so there are very few. So at the moment, it is not recommended in children under the age of 16 because they were not a part of the study group. It is not recommended in pregnant women because they were not a part of the study group. Okay, and in terms of the whole allergy story, whilst the restrictions were quite strict at the beginning when we didn't have as much data, then those are being relaxed. So having allergies do not automatically eliminate you from being eligible to receive the vaccine. If you have allergies or if you have severe allergies or history of anaphylaxis, they may want to be more cautious with you and observe you for a longer period of time. But you should declare that. But just automatically having allergies, but just having allergies will not automatically disqualify you from having the vaccine. There was also a documentation regarding anticoagulation. I'm not talking about aspirin or Plavix, clopidogrel, but drugs such as warfarin and other anticoagulants. There is some precaution that was mentioned regarding those drugs in terms of getting the intramuscular injection in terms of the vaccine. So you should declare that. You should discuss it with your physician. That's not an automatic disqualifier, but it should be on a case-by-case basis.
Nurse Brown, we have one question from YouTube, from one of our YouTube listeners, and it says, if an individual gets the virus after receiving the first dose, would that individual need to get another 2 doses afterwards or just one?
Just one. So you still just need to get 1 dose. You don't have to restart the whole series.
All right, thank you. A question is asked, how many strains of COVID-19 are there? And is this vaccine effective against the different strains?
Okay, so there are many. We know that viruses do tend to mutate. It's a part of their natural progression. But there are many strains, and know you've heard a lot in the media about the UK strain and the South African strain and so forth. Now, Pfizer has been looking at their effect, the effectiveness of their vaccine against these new strains that we're hearing more about. And so far, the early data suggests that the vaccine is still effective against the UK variant and the South African variant.
Okay, thank you. A question was asked as well if persons with diabetes were a part of the study group.
So persons, they were represented in the trial group, yes. And persons who have diabetes are actually a part of the high risk group at being at risk of more severe COVID and would benefit significantly from receiving the vaccine.
Okay, thank you. A question is asked, do they have several EpiPens at the hospital while this is happening, for example, during the vaccination process?
So what we do, so EpiPens contain epinephrine or adrenaline, okay, it's different names, same drugs, but what we have the actual drug at the hospital. So the EpiPen is really for use in the community. So you just jab in your thigh if you develop an allergy, but the hospital is equipped with the drug adrenaline, also known as epinephrine, so that can be administered if a person develops anaphylaxis.
Okay, thank you so much. And another question that I need some clarification to, as it regards to allergies with the COVID vaccine. I know that, for example, some immunizations or vaccinations, they would look for persons who are allergic to, for example, eggs. Are there any specific food that was ever mentioned, I don't know if you have read in your research, that would have contributed to allergies in using the COVID vaccine?
So no, there were no specific foods that the vaccine manufacturer recommended to say, well, that this particular food group posed a risk if you had an allergy to that particular food group.
All right, thank you. And while we're on that, are there any drug interactions that you are aware of? Because persons are always asking, as it regards to, for example, taking anticoagulants, for example, aspirin. We have had a number of psychiatric patients as well who have asked, like in terms of they are on the psychotropic medication, is there any medication that there are contraindications? So if you are on those medications, you need to be extremely cautious.
So at the moment, the only medications that were highlighted for caution or for precaution were the anticoagulants. And for the anticoagulants, we're talking about the warfarin and things like Xarelto and apixaban and so forth, not aspirin or clopidogrel. So, but the other drugs, I mean, at this point in time, whilst the trial population included a variety of people, at this moment, the other drugs are not contraindicated.
Okay, thank you. And someone is, J. King is saying, thank you, doctor. Great presentation. Feeling a little bit more comfortable with the idea of getting vaccinated. Still skeptic. All right, we thank you for your questions. Are there any other questions, Brother Banton? Are there any other questions?
I have one more question on YouTube. It says, what are the main ingredients in the COVID-19 vaccine?
Well, the main ingredients in the COVID-19 vaccine are the mRNA, which by now you know what that is. And then that mRNA is surrounded by a lipid coating. And this lipid coating is just acted as a vehicle to transport the mRNA from the site of injection into the cell. You know, scientists have been looking at mRNA for a long time, but one of the problems with it is that it degrades so quickly, it couldn't even reach its destination. So that lipid coating keeps it protected to get it to its destination. So that's pretty much what it contains.
Okay, thank you so much. And if we have no more questions, we just really want to thank Dr. Forbes for a very enlightening presentation. For me, it was very, very, very informative. Basically, the way you started with just general knowledge of what the COVID disease is, moving on to a better understanding of the mRNA and how it really works. And so we just want to say thank you very much for an enlightening presentation. The information would have been well received. Thanks to our audience, all the persons who have joined us this afternoon. Thank you very much for your questions. I hope that all your questions have been answered. And we do hope that from time to time, if there are any questions, additional questions that you'd want to ask, feel free to visit the hospital, call the COVID hotline, or speak to your general practitioner. Someone is asking, Lida is asking, I'm on 14 different medication. Is it safe to take the vaccine? I don't know if you want to answer that separately, but we have answered in terms of she had looked at different medications as well in terms of speaking to your general practitioner prior to taking the vaccine. And there are now, since yesterday, there are 5, in addition to the hospital, there are 5 other institutions that are offering the vaccine, and it is still free. So, Dr. Forbes, would you shed some light on the different places where persons can access the vaccine?
Sure. So these are the, thank you. So these are the various private clinics within Providenciales. So these include, I don't want to leave anyone out. So you have Grace Bay Medical Center. So that's Dr. Slattery's practice in Grace Bay. You have Associated Medical Practices. That's Dr. Menzies' practice. You have Family Care Medical Center, Dr. Darren Hall and his wife. You have Omnicare Medical Center in downtown. That's Dr. Rufus Ewing and his wife. And you have Carolina Medical Center downtown. That's Dr. Hugh Malcolm and his team, his daughter and their team. So those are the 5 centers. Those are pretty much the private practices that are also offering the COVID-19 vaccine. So if you are already a patient of those centers, then that's a natural way to go. They have your history already. And if you have any concerns about your particular situation in terms of whether you should take the vaccine based on your medical conditions or based on your medication, you can always speak to your physician and get advice from them.
Okay, thank you so much. And the important thing is that there are options. So there are a number of vaccines being made. There are a number of vaccines that are on the market. However, it is the Pfizer-BioNTech that is available in TCI currently. I'm not sure if in the future they will get other vaccines. However, as was said before, if there are any questions, additional questions that you would want to ask, you can feel free to ask your general practitioner. You can call the COVID hotline, and you can basically visit hospital and speak to one of the public health nurses. Again, doctor, I just want to say thank you very much for a very informative presentation. Thanks to everyone who have joined in, and we just want to say thank you and have a good evening.
Thank you. You're welcome. Remember to register with the registration site for the vaccine.
But before we go, I think we should close off with prayer.
Okay.
So at this time, we will invite our pastor to do the honors of the closing prayer for us.
All right, let us pray. Heavenly Father, Lord, we thank you for the information that we received this evening. And we pray that you will guide us to make the best decisions for our health, dear God. Lord, I pray that you will continue to bless your people, continue to be with doctor and those who work on the front line. Keep them safe, dear God, as they seek to help this community to get over this pandemic. In Jesus' name, amen.
Amen.
Bye, everyone. Thanks for joining in.
All right, bye.
Bye-bye.
Bye. Thank you.
Bye.
Bye-bye.
And if there are any topics that you would want us to discuss, feel free to contact the health ministries personally. You can speak to David or myself, and we will try as best as possible to get the resource persons to facilitate. So thanks again, and feel free to tell us what other topics you would want to hear of.